Hi everyone, sorry I can't be there this Friday. I just wanted to still present on my LI just because I thought it was an important concept and I wasn't sure if it will be covered in class. So to go over the normal conduction system, you know that depolarization starts from the SA node to the AV node to the bundle of His. From the bundle of His, it splits into two main branches, the right and the left branch. The right bundle further branches into fascicles. The right bundle branch only has one fascicle right here, while the left has three. It has the anterior fascicle, the posterior fascicle, and then the left middle fascicle. Remember the left middle fascicle because this is the one that supplies the interventricular septum. This is also reflected in the EKG. So remember, the septum is supplied by the left branch. So what's a bundle branch block? Bundle branch block is a delayed in the interventricular conduction. It's typically due to injury to the bundle branch of the fascicle. Chronic conditions can cause a bundle branch block. This includes hypertension, coronary artery disease, or cardiomyopathies because it can cause remodeling of the heart muscle itself. Acute causes include ischemia, myocardial infarction, or myocarditis. So let's go over the left bundle branch block. As you know, signal starts at the SA node to the AV node to the bundle of His. Now, because signal can be propagated to the left, it can still be propagated to the right, so therefore you still get right ventricular depolarization and therefore right ventricular contraction. Now, the fibers from the right Purkinje fibers start sending signals to the left, eventually causing a left ventricular depolarization and thus left ventricular contraction. So in a left bundle branch block, both of the ventricles are still able to contract, but the only difference is that in the left ventricle, it's contracting at a later time than the right ventricle. So in a right bundle branch block, again, similarly, still get signal coming from the SA node to the AV node to the bundle of His. And then now this time, because signal can't be propagated to the right heart, still gets propagated to the left heart. So it goes down left bundle branch, depolarizes the left ventricle, causes left ventricular contraction, and then signals from the left Purkinje fibers then goes over to the right ventricle, causing right ventricular depolarization and eventually right ventricular contraction. So similarly, in the right bundle branch block, both of the ventricles are still contracting. The only difference is that the right ventricle is contracting at a later time than the left ventricle. So this is reflected in the EKG. So you know that the QRS complex of the EKG represents ventricular depolarization. Under normal conditions, this is typically about 80 to 100 millisecond wide, so that's about two small boxes wide. If there is a delayed depolarization of one of the ventricles, the QRS gets wider. Typically, it's more than about 120 milliseconds, so this is more than about 3 small boxes. And you want to look for this at limb lead 2. And then in order to determine whether it's a right or left bundle branch block, you would use the precordial or chest leads. So in lead 2, you only get a frontal coronal view of the heart versus the chest leads, the V1 through V6 gives you a more circumferential view of the heart. Because of the way the heart sits in the chest cavity, the left heart chambers are closer to V6 and the right heart chamber is more anterior, therefore it's closer to V1. So we're going to use V1 and V6 to determine whether it's a right bundle branch block or a left bundle branch block. So let's go over what would happen under normal conditions. So normally the septum is going to get depolarized first. So remember earlier I told you that the septum is supplied by the left bundle branch. So you're going to get signal going down this way. So because the signal is going towards the V1 lead, you're going to get a positive inflection in V1. And because the signal is going away from V6, you're going to get a negative inflection in V6. So next, the wave goes to the ventricle to depolarize the ventricles, and because the left ventricle has more mass, you're going to get a huge positive inflection in lead V6. And then because the signal is going away from V1, you're going to get a negative inflection here, and then a positive inflection here because signal is going towards V6. Okay. So what happens in a left bundle branch block? So in a left bundle branch block, now the overall direction of depolarization comes from the right side. So it's going to go this way. So because it's going away from V1, it's going to have a negative inflection. Because it's going towards V6, it's going to have a positive inflection. And there's this notch here on V6. This is just because the right ventricle is depolarizing later than the left ventricle. So it gives it a W shape on V1 and an M shape on V6. In contrast, in right bundle branch block, so in right bundle branch block, the first part is similar to normal because you're going to get the septum to get depolarized first. So remember, the first signal goes this way, so you're going to get a positive inflection towards V1 and negative inflection towards V6. Next, the left ventricle depolarizes. So because the left ventricle depolarizes, you're going to get signal going this way next. So that causes a signal away from V1, so you're going to get a negative inflection and then a positive inflection towards V6. Okay? And then next, the right ventricle depolarizes because of the signals coming from the left Purkinje fibers. So next, you're going to get signal going this way. So next in V1, because the signal is going that way, you're going to get a positive inflection. Because it's going away from V6, you're going to get a negative inflection. So in contrast, now we have an M in V1 and a W shape in V6. Hope this makes sense. So to put it all together, so in the left bundle branch block, you're going to get a W form in V1, M form in V6. In the right bundle branch block, you're going to get an M form in V1 and a W in V6. So osmosis has a really good mnemonic for this. It's William Marrow. So just know that the L stands for left bundle branch block and the right stands for right bundle branch block. So causes of right bundle branch block is typically due to a structural issue than a left bundle branch block. So this is some of the causes are core pulmonary embolism, myocardial infarction, myocarditis, hypertension, ASD, iatrogenically in patients undergoing right heart catheterization or ethanol ablation and hypertrophic cardiomyopathy. Remember that core pulmonale is right-sided heart failure due to an enlargement of the right ventricle due to high blood pressure in the lungs, usually caused by chronic lung disease. In contrast, in left bundle branch block, it's typically from slowly progressive degenerative disease such as high blood pressure, coronary artery disease, enema, myocarditis, aortic stenosis, Lyme disease, or side effect of surgery such as aortic reconstruction. Okay, and management of the bundle branch blocks, sorry, this is supposed to say right and left. Typically, patients with isolated or chronic bundle branch block are generally asymptomatic and they don't need any intervention. Pacemakers may be needed if syncope occurs, particularly if other conduction disturbances are present, such as an AV block. Currently, cardiac resynchronization therapy is not recommended for patients with right bundle branch block. And that's it. Please email me if you have any questions. Thank you.